Yes, good afternoon. Karibuni sana. Thank you for joining us. Those who are joining us from YouTube, welcome on board. Those who are joining us from Zoom, thank you very much for your time. We are starting immediately. Today marks the 4th month of running this webinar on a weekly basis. And yesterday was a very important day for us as counselors because we had a national guideline on mental health at workplace and wellness, which is a very good news for us, meaning in Kenya, people will start to adopt and practice wellness in terms of mental health. So that is a breakthrough. Another breakthrough for counselors, we are having a counselors and psychologists board, which is about to do registration. So practicing in Kenya, you need to have license and registration. That one is also a plus for us. At least now will be regulated. People will be seen and acknowledged and appreciated, and then we'll be able to move mental health matters forward. So without further ado, let me introduce our guest. This month being a very special month because we are talking about suicide prevention, the whole of this month. Then on 10th September, we have Suicide Prevention Day. This was marked worldwide. So with me, we have a guest. She's known as Susan Chebet. She's a clinical psychologist by profession. She's a registered member of Kenya Psychologists and Counselors Association. She has done undergraduate at Chuka University, Bachelor of Psychology, and she's also pursuing Masters in Clinical Psychology at Daystar University. She's trained on sexual violence and gender-based violence by MSF, Medicine Sans Frontières, or Doctors Without Borders. She's also trained on global mental health by University of Washington. She is currently working as a hospital psychologist at Ganjoni Dispensary, Mombasa. So kindly let us welcome Susan Chebet, our clinical psychologist, who will be taking us through matters to deal with anxiety management. Karibu sana mwalimu. Karibu.
Hola, ladies and gentlemen. Good afternoon, everybody. Can you people hear me? Am I audible enough? Kindly, someone can answer.
Yes, you are.
Oh, thank you so much, Raro. Well, let me say thank you for this opportunity that Zedekia, my colleague, the psychologist, has given me, so that we can share a very important aspect of mental health. As you all are aware that this is a very, very special month for us. It is a mental health month, and furthermore, a suicide prevention month. So I normally say, I have a slogan that I say, there's no health without mental health. And it all starts by So it all starts by us. First of all, we need to understand what is this mental health. And for today, we're going to know that there are several causes of mental health, several types of mental illness as well. But now for today, we're going to handle anxiety as one of them. So just to begin with, we have to understand what is anxiety. What is anxiety? So, and to start with that, we say that, first of all, anxiety is a normal emotion, and it's your brain's way of reacting to stress and alerting you of potential dangers ahead. So first of all, anxiety is normal to begin with. We all go through anxiety at different points of life. So we say that everyone feels anxious now and then. For example, You may worry when faced with problem at work, before taking a test, or before making an appointment. So we say that occasionally anxiety is okay, but anxiety disorders are now different. Are we together? Aha. So we are proceeding from anxiety. Now we are going to understand what is anxiety disorder. What are anxiety disorders? Maybe just to throw it back to the group, maybe somebody can tell, what do you think are anxiety disorders now? Because you've just said that anxiety is a normal body reaction. Somebody? Anybody among the group? Somebody can tell us, what do you think is anxiety disorder? Aha. Or someone can also make some chat as well. It's allowed. Well, yes, is somebody going to tell us maybe what they think anxiety disorder is?
I would like to try.
Yes.
So this is Nanis. So I think the anxiety disorder is maybe where someone is very disturbed, and that they are not able to be calm. And some of the symptoms maybe would be less concentration when doing a task, or even loss of sleep.
Thank you so much, Nanis. I'm grateful. Thank you for your participation. That's a perfect, great answer. Thank you so much. Thank you so much. I'm also seeing somebody has commented something here. Let me check on the chats over here. Someone has said, sorry about that. It's okay. Now let us, we shall proceed from there. So anxiety disorder, we are saying that there are a group of mental illnesses that cause constant and overwhelming anxiety and fear. So for it to become now a disorder, it causes constant and an overwhelming anxiety and fear. And the excessive anxiety can make you avoid work, it can make you avoid school, it can make you avoid family get-togethers and other social situations that might trigger or worsen your symptoms. So just like Nanis has said, so you find this extreme goes to a point whereby even sleep becomes a problem. Okay? So to proceed from there, we need to understand now what are now the types of these anxiety disorders. And now we all know them, but just that probably we were not aware that they have specific names. So for today, we're going to share, there's what we call generalized anxiety disorder. So this is where you feel excessive, unrealistic worry and tension with little or no reason. So for generalized anxiety, you have no specific fear, but you just feel excessive and unrealistic worries, you know, and just like overwhelming tension, yeah, with no specific reason. You don't understand like what is making you feel this way. Like it's not that you fear a particular thing or maybe a particular person, but it's just happened suddenly. We call it generalized anxiety disorder. So and then from there we have another disorder that we call panic disorder. So this is where you feel sudden intense fear that brings on a panic attack. So one may break into sweat. So these are some of the symptoms of this panic disorder and a few symptoms of the anxiety. Yeah? So you find yourself, you break into sweat when in this episode of panic disorder. You have chest pains, yeah? And you find that your heart is pounding. You're having palpitations, like your heart is running really fast. So we say that sometimes one may feel like you're choking or having a heart attack. For those experiencing these panic disorder, they understand exactly what it means, because you feel like you're sweating throughout the body, your chest is painful, your heart is pounding. Of course, when the heart beats so fast, your chest is going to be really painful. At the same time, when all this is happening, this overwhelming feeling, you feel as though you're being choked or as though you're getting a heart attack. So that is panic disorder. So the other disorder is social anxiety disorder or social phobia. Yeah? It's basically fear of public settings. You find like maybe you've just been invited for a public gathering, or to give a speech, or to just speak to a number of people. So you start feeling some obsessive worry about being judged. You ask yourself, maybe they may judge me, they may say don't look good, they may just look at mistakes that I have. Also as well, you feel embarrassed and you feel as though they may ridicule you. Yeah, so that fear of the public, we call it social phobia. Okay, at least now we understand that it has a name. It is social phobia. Then the other one is a specific phobia. Okay, so we say that this is intense fear of specific objects, situations, for example, heights, flying. So when we discuss of specific phobias, you fear a specific thing. Like I have clients that fear centipedes. Yeah, specifically when they see centipedes, like they feel an overwhelming emotion and they just feel like they have to run away. And it becomes too extreme for them. Some fear heights. Yeah, when somebody's somewhere, maybe a raised building, you find they feel as though they are falling on that building, like you're on top and you feel like you get some dizziness aspect and your heart is palpitating. You find sometimes maybe you feel as though something is pulling you to fall from the floor. Yeah, so those are specific height phobia, and we shall also learn later on what are these causes that might lead us to this particular anxiety disorders. So the other anxiety disorder is what we call agoraphobia. I understand that they sound a bit technical terms, but these are normal, these are normal things that happen, just that right now we are giving them a particular name that somebody can understand which probably disorder they are going through. So the other is agoraphobia, which is a fear of places where it's difficult to escape or get help. Yeah. For example, on a plane, when somebody's on a plane, they feel like, oh my God, in case anything happens here, we're just dead. Yeah, like I can't run away, I can't go anywhere. So they feel that extreme and overwhelming feeling. Also in a public transportation, for instance, if somebody's in a car or on a train, yeah, somewhere that's enclosed, they feel like, oh yeah, this is the end. This is the end. So they start developing this excessive, yeah, and an overwhelming feeling, yeah, of anxiety. And also in a crowd, maybe in a crowd it's difficult to escape. Yeah. The other disorder is what you call separation anxiety. Yeah? So for separation anxiety, one feels scared or anxious when a loved one leaves your sight. You always worry something bad may happen to them. So for separation anxiety, it not only happens to the children, it can also happen to us as grown-ups as well. So separation anxiety is when you fear when somebody leaves your sight. Okay, you fear that probably something bad may happen to them or something worse may suddenly happen to them when you are not around them. So when it now becomes excessively, it becomes overwhelming until it interferes your day-to-day activities. Now it becomes a disorder. Yeah? I hope we're together up to there. The other one is the final one is what we call selective mutism. For selective mutism, for instance, you find young kids who talk normally with their family, don't speak in public or at school. Yeah. So you find for this selective mutism, let me give a good example of the children. Yeah, you find a child who is able to speak so well with family members. All of a sudden, when they're taken maybe to a new setting, they suddenly fall mute. They cannot communicate, they cannot talk to anyone. So until it reaches a point like it's now overwhelming and it's now interfering with their day-to-day activities. They totally fall mute. They cannot even communicate. So that is now to call selective mutism disorder. It also happens to grown-ups as well. You find that someone can speak on particular settings, and we are going to understand what might be the cause of these anxieties, what might be the cause of these disorders. Yeah, like that for selective mutism. You find even in adults, maybe if somebody has gone through maybe a particular situation or a trauma in life, even when they're with their family or with a particular person, they communicate fluently. But when they're out of that environment, they totally go mute. Someone even may think maybe they have no vocals. So from there, we are going to go straight away to what are the symptoms? Now we have to understand what are the symptoms of this anxiety so that we can be aware. We say that knowledge is power. Yeah? It helps you to understand exactly what is happening to me or what is happening to the other person who is next to me. So we're going to check on the symptoms right away. The symptoms of anxiety disorder. So the first one is panic, fear, and uneasiness. You find that you panic, you find that you fear, and you feel so much uneasy. The second one is that the second symptom is that you have feelings of panic or doom or danger or something that worse is going to happen. That's a second symptom. The other symptom of anxiety is sleep problems. People are not able to sleep, just like Nanas shared to us. You develop sleep problems, or you sleep and wake up every now and then, like disturbed sleep patterns. The other symptom is not being able to stay calm and still. So you find somebody whenever they are seated anywhere, if it's in the public or maybe somebody leaves them, or maybe in a particular situation, they find themselves, they are so much restless. They're not able to sit still. They're not even able to even concentrate. They feel like they're so much restless. So the other symptom is also the feeling of cold. You feel your hands are sweaty, you develop numbness, some tingling feeling on your hands and on your feet. And most of these feelings are, they occur almost the same time. Okay, then the other symptom is shortness of breath. Yeah, shortness of breath. The other one is breathing faster and more quickly than normal. We call it hyperventilation in other terms. Yeah, you find us breathing so fast and more quickly than even normal. The other thing is the heart palpitations, like the heart is beating really fast, just like the first symptom as mentioned. The other one is you feel the dry mouth, that your mouth is totally running dry. Yeah. The other symptom is nausea. Some people present when these symptoms occur all together, someone feels nausea, some of them throw up. Because these are overwhelming feelings for our body and even our mind to handle. It's not easy. The other symptoms is dizziness that normally occurs. Yeah. The other one is thinking about a problem over and over again and unable to stop. Yeah. With anxiety disorders, you find yourself, you normally think about a particular problem over and over and over again, and you are unable to stop. It's running out of control. Yeah. In other terms, we call it rumination. Okay. So you find yourself thinking of the same problem over and over, talking about the same problem over and over, and you're still not able to get any solution. You cannot stop the thinking. So the other symptom is inability to concentrate. Yeah, which I mentioned before. So you find it's a bit difficult to concentrate because of that restlessness. You cannot sit even still, so you cannot even focus or concentrate on anything. So productivity goes low. The other symptom is intensely, obsessively avoiding feared objects or places. This can happen basically depending on maybe we shall handle on the causes. And maybe if a particular trauma happened, or at a particular time or at a particular place by a particular object or person, you'll find yourself will always intensely and obsessively avoiding such a place or such an object or such a person that probably caused a particular trauma. So to proceed from there, we are going to discuss on some of the causes, and I want to throw it back to us. I'd like somebody to share to me, what do they think are some of the causes of anxiety? What do you think? What do you think are some of the causes of anxiety? Somebody? Somebody can tell me what they think are some of the causes of anxiety. You can also chat.
Network.
Yes, John White Service. Thank you.
You're welcome.
Something
like,
like we have Raro.
Hello.
Yes.
Problems, general problems.
General problems, very true. That even can lead those and general anxiety disorder, like someone has no specific, very good.
Sometimes you are being uncertain of what you need or what you need to do or what you have to do. Uncertainty.
Thank you so much.
Or build up stress.
Sorry?
Or a build up stress.
Yes, build up stress, what you call unfinished past businesses. Yes,
Thank you.
Thank you.
Until I have that one.
Wow, thank you so much, John White Services, for sharing. Anybody else, maybe? As we await for somebody, maybe Zed can read for us on the comments that we do have. Yes, Zedekia. Okay, Well, thank you so much. Maybe we can proceed from there so that now we can check.
Okay, thank you very much. I can see from Nani. Just a minute. Let me.
Yes, Zed.
Okay, I feel you can hear me. We have Fear of Unknown from Virginia Njuki. Then we have Patricia Mutula saying trauma or working in a toxic environment. And then we have yes, Patricia Mutula, the Fear of Unknown. And then we have another one from Raro. Maybe he was answering another question, which was talking about definition of anxiety, when one displays the symptoms over a length of time. So we have that one definition, and then the causes is trauma, and then we have the fear of unknown, and then we have the working in a toxic environment. Those are the charts from the you can proceed.
Well, thank you so much, Zed. So now we can proceed on checking on the causes. And thank you everyone who has contributed on the chat box. Thank you so much, Helen. Thank you, Virginia. Thank you, Linda. Oh, Linda's also said emotional abuse. Very good. It's also true. And thank you, Lucy. You've also told us that some of the causes can also be fear of past painful experience or recurring. Thank you so much. All your answers are very much true. So now we can proceed to check on now what are the causes of anxiety disorders. So, and to begin with, the first cause is that it is genetic. When I say genetic, what I mean here is that some of the mental illnesses are in the family. So genetic is whereby it is it's hereditary, like it's from one generation to another. So it is something that is in the family. So you find there's a history of particular mental conditions in the body, in the family. So when you say it's genetic, it's something that is running in the family. Yes, so the other cause of anxiety disorder is the environmental stress. So stressful events that you have seen or have lived through. So for example, this environmental stress is that a childhood abuse, childhood neglect, death of a loved one, being attacked, yes, like maybe being mobbed, somebody gang by gangs. So the other one is also seeing violence. So we normally say for children, whenever parents, when we're doing parenting, when we're psychoeducating on parenting, normally say that parents should really avoid arguing, throwing tantrums among themselves before children, because that's trauma already. So, and also you find these families that maybe the dad is maybe uses some particular drugs. There's several fights, verbal abuse. That is already trauma to the children. Okay, and they risk these children developing anxiety later in life. So the other cause of anxiety disorder is what we call drug withdrawal or misuse. So you find alcohol and substance use. So you find these substances, alcohol and substance, they are directly related to anxiety. They automatically cause or may lead to anxiety later on in prolonged use. So you find use of alcohol or any other substance, be it bang, any other substance, you find if you do not choose, it causes some withdrawal symptoms of anxiety. So the other symptom cause is medical conditions. Medical condition, for example, maybe someone has a heart problem, maybe a lung problem or a thyroid condition. So it may lead to anxiety. Medical conditions as well, any condition that somebody has been diagnosed with, it normally leads to certain fear, fear of unknown. So as time progresses, without maybe counseling or psychosocial support, it can lead to anxiety disorder. So the other cause, so those are the causes. Then the other risk factors now. What are the risk factors? Now we're going to learn more about the risk. What can risk one person to maybe getting an anxiety disorder? So we're going to begin with like history of mental health disorder. Maybe if somebody maybe was previously diagnosed with a particular mental condition, be it depression, or any other mental bipolar, you find that it normally, especially with depression, later on it can lead to anxiety. Because when you have stress, it can either break into depression, it can break into anxiety, or now sometimes it can break into both with different episodes, just like in bipolar. Okay, so history of any mental health condition can risk someone to anxiety. So the other risk factor that can risk someone to maybe anxiety disorder is childhood sexual abuse. So this is what we mean is any emotional, physical, sexual abuse or neglect during childhood is linked to anxiety disorders later in life. So any childhood sexual abuse or any abuse, be it emotional, physical, sexual, or neglect where parent was never there, or they were never there in a child's life. They are present but absent in a child's life. So you find later on it's directly linked to anxiety disorders when somebody is an adult. So that's why we say maybe if there's any trauma that happened to a child, like I've been trained on sexual and gender-based violence. So what we normally say, I think it's really important for you to know as well, is that any case, maybe somebody has been violated sexually or physical abuse, they've been beaten or tortured. It's very, very important. The first thing that they should do is to go to the hospital, any nearest hospital within 72 hours. Kindly pass this information. Anyone who has been maybe sexually abused, you know, or any physical abuse, yeah, especially for the sexual violence, this one is very critical. Okay, for the children or an adult, let them run straight away to the nearest hospital for the within 72 hours, because this one can help a lot. There they will get psychosocial support from any psychologist or counselor around, and they're also going to get some medical support immediately. Yes, yeah, which can, medical side can also help a lot in prevention of pregnancy, prevention of maybe HIV, because HIV can be prevented within those 72 hours, but if it proceeds, it may be a bit difficult, and other health conditions, STIs as well, and other medically related conditions can also be prevented within 72 hours. Even if it's a young man that has been sexually abused, maybe straight away rush them to the hospital, not the police station. Take them to the hospital first. Then the other risk factor is trauma. Yes, somebody already mentioned. So trauma, any kind of trauma, when you say trauma, is any near-death situation. It normally leads to anxiety. So you find for trauma, it can risk someone to PTSD, which is post-traumatic stress disorder, which can cause panic attacks. So you find for trauma, if somebody has gone through any trauma, yeah, and maybe the person hasn't gone through counseling or any professional help, later on in life, it may start presenting as post-traumatic stress disorder, which some symptoms is panic attacks. So any form of trauma can also risk someone to anxiety. So the other risk factor is negative life events. Yes. Yes, and we all go through this because we are all in this world together. We're all in this world, not unless somebody is maybe dead. You say, no, maybe they're in another world. But now since you're alive, you know, it's negative life events are normally there. Like, for example, someone losing a parent in early childhood. Yes, in early childhood, or any other negative event like a divorce, marital issues as well. Loss of a child, any negative event in life can risk someone to anxiety if they do not get any professional help as soon as possible. So the other symptom is risk factor is severe illness or chronic health conditions, which we already mentioned on some of the causes previously. So any severe illness, like somebody has been diagnosed with any chronic illnesses or a life-threatening illness, if maybe they do not go to a psychologist or a counselor for psychosocial support, emotional support, it becomes a bit difficult for them to adjust. So it may risk them to a mental condition, which also includes anxiety. So the other risk factor is substance abuse. People are abusing substances. They're at higher risk of getting anxiety disorder later on in life. Any substance, alcohol and any other substance, be it bang, whichever. So the other risk factor is low self-esteem. So low self-esteem as well can risk someone to anxiety disorder. So when somebody who is developing low self-esteem, there must be something that probably they went through in life, or that's why they're feeling low about themselves. So you find that most of them, especially those with the shyness, you find that it may risk them because with the low self-esteem, you fear even maybe expressing yourself, maybe, standing in a public gathering. So later on, it can lead you to anxiety disorder because you have constant fears every now and then. So the other risk factor is being shy as a child. Yes, some of us might have been a culprit here. So being shy as a child is linked to social anxiety in teens, teenagers, and adults. So if maybe somebody was so shy when they were a child, and probably now for them, they did not get any social support that can help in boosting their self-esteem. So they get fixated, and later on in life, they develop social anxiety, whereby they fear the public, they fear expressing themselves, and later on it can even be a disorder in adulthood and even in teenagehood. So that is it. So from there, we are going to check on the next slide. So I hope we have all understood about some of the courses. So just to come back to us, maybe what do you think about some of these courses? Maybe has somebody ever experienced, maybe do you have somebody or know someone? Maybe one person can just share a brief experience, briefly. Have you ever experienced this? Or have you ever seen someone going through some of these symptoms, some of these risk factors, or have you ever handled or seen someone who's going through this before? Yes. Yes, yes, hello. All right. So, maybe is there somebody who has any experience?
Hello.
Hello, Linda Joyce.
Yes. Let me just share my story. I experienced some vicarious trauma. Hello. Hello. Yeah, we're together.
Yes, I'm getting you right, Linda.
Okay, I experienced some vicarious trauma, which occurred during my practice at work, and it really gave me a lot of anxiety. And it took me a while to get back to the area that I had experienced it. I am a nurse by profession, and so I happened to lose a mother at the maternity ward, which was very, very tough on my end, being the first time losing a mother at the ward. And so we had to go through an auditing process. And of course, you know, death is inevitable. But with the Maternity Zero campaign, it was quite tough on my end. And so in the process, I had to answer questions that God could only answer. And so after that, it really affected me in my practice. But eventually, I walked through the process, and I faced my fears after that ordeal, and I was able to go back to work again. Yes.
Wow, wow, wow. Thank you.
Yes.
Thank you so much, Linda, for sharing. Thank you so much.
Thank you.
Yes, I'm glad that you were able to get through. Yes, and thank you for sharing and letting us know about your experiences. This one acts as a, you know, for someone else who's going through it, you know, it really helps a lot because somebody feels they can also get through it. So you become like a successful story to somebody else, and it gives others hope as well. Thank you so much, Linda. So to proceed, so for now, we are going to check on what are now the treatment now. What is the way forward? What is the way forward? Okay, so to start with, it's we normally say at first, that's why I have first of all taught you on the causes, made you understand first of all what is anxiety, what are the probable causes, okay? What might risk someone to this anxiety, okay? And I think we have also gone through the symptoms as well. So when somebody is aware, now what is the way forward? When you're aware, it's very important for you to visit any nearest facility, like I normally say in these public hospitals. You just go and ask for maybe a psychologist, okay? And a psychologist is going to help you a lot. So the psychologist will do the assessment, and if maybe they see maybe a further need for psychiatric intervention, is then now they are going to do the referral, okay? They're going to do the referral for you. And then now from there, you're going to get help. If the psychiatrist sees the need of you getting some medications, they will do the necessary prescriptions. But we now avoid over-the-counter medications, because some of the over-the-counter medications that also trigger anxiety as well. So when you feel any of the symptoms that you're going through, not that you just feel one symptom and you diagnose yourself with anxiety, okay? However, most of the symptoms normally, they work, like they come all of, like you find you have disturbed sleep pattern, you have the avoidance, you know, you have the palpitations, they all come in together, yeah? When you feel such an overwhelming feeling, okay, some overwhelming feeling, and maybe a particular change that is interfering with your day-to-day activities, finally, it's very important to rush to the nearest facility and seek for help where need be, okay? So this first treatment is the medications. We have then there's normally medications. The treatment, there's medication. So when you go to the hospital, first of all, they are going to assess you, okay, so that they see if there's need for medications. And then now the other one is psychotherapy, which is counseling, okay. So we normally say this work hand in hand together. I have seen clients who have only been given medications but have never attended counseling sessions. So if the medications are only going to minimize the severity of the symptoms, but now they have not tackled, yeah, the cause and the triggers, yeah. So you find the cause, if it's not managed well, you find even the medications may not work. So when somebody maybe has been prescribed for medication for anxiety disorder or any other condition of mental, it is very, very key to attend counseling sessions so that you can be taught on how to manage your emotions and how your emotions affect your behavior. So with that, thank you so much. That marks the end of our presentation today. And I want to say thank you so much for your contributions. Thank you so much for you being here today. And I look forward to maybe having more sessions with you. So I throw it back to Zedekiah. Yes. Mr. Zed. So first of all, I am seeing on the chats, that there is a request on how, Patricia is kindly asking that.
Thank you very much, Susan Chibet, our clinical psychologist, one of our guests. There is a request in the inbox. Kindly you can check and then you proceed. Kindly check the inbox.
So first of all, I am seeing on the
Okay, so on my inbox here, I am seeing Patricia. Patricia is requesting if Linda could share how she overcame the trauma. Yes. Okay. Then Patricia is also asking, what is the worst of anxiety if not attended to? So before Linda shares, so Patricia is asking, what is the worst of anxiety if not attended to? So to start with that, we've seen the symptoms, okay? The palpitation. So you find that what happens, these mental conditions, they interfere with your day-to-day activities. So you find if it's work, you're not able even to attend to work. Concentration is a problem. Sleep is a problem. You cannot even sleep. So without even sleep on its own, you find that even productivity becomes very low. Okay, and that aspect of restlessness, yeah, you cannot sit still in one place, yeah, becomes very difficult for you to run your day-to-day activities. So that is the worst that happens, and that is actually what brings in on the symptoms. What brings in, like, somebody start to identify that you are not even okay. So it totally destabilizes. So with mental conditions, they destabilize your day-to-day activities. So if you find yourself like you're not able to go work, you're not able to do, maybe you're married, you're not able to relate well with your family anymore, with your children anymore, they feel a bit distant. So you find it totally destabilizes your day-to-day activities. So that's why it's very important for you to attend to for medical help, and also attending for psychological counseling. We go to a psychologist first, so that they can help in assessing the intensity of the condition. Then also somebody is asking Helen is saying brief and to the point. Thank you, Suzanne. Thank you so much. Thank you so much, Helen, for your appreciation. We also have Sheba, who is saying, I want to share about my anxiety working at a hospital. Yes, sure. So Sheba, the floor is yours. Kindly share with us. And thank you so much for your courage to share with us about what you went through. Yes, Sheba.
Hello.
Yes, karibu Sheba Isa.
Thank you very much.
Mhm.
Okay. Actually, I've been working in a county
Mhm.
hospital,
Yeah.
just like an year
Mhm.
ago. So when I was working there, actually, I am a health and safety officer, but I just went there to actually worked so that I can go and climb up for a very nice position because it was county.
Mm.
Now I was working as under nurses because I had this very nice, what is it called? A very nice platform of how to know to do first aid. That is why I was hired there. So I was helping the people who actually was accidents, what are they called? Accidents, like everything that was coming as an emergency in that hospital, we used to handle. And it was really, really, really not okay, because I've never seen that in my life, because not having an idea of how to handle all those things, because when you are at site as a safety officer, that is not what you're prepared for. Okay, yeah, you can be prepared for, but there are people who are properly, they are professionals for those kind of things. But I've never been prepared for blood, a lot of brains oozing out of somebody's brains, you know. Now I'm here, I'm helping the nurses, and I came across all that. Okay, that was not even the problem, because I am not blood, but I'm not even afraid of seeing somebody who is not okay, but I am just afraid of somebody who is dead. At least somebody who is going to be helped, I can help. But somebody who is dead, that's something else. Now that is my trauma. So I actually ended up having one morning when I went to work, I just arrived at work, and then I was told, like, okay, can you take this person? I didn't even know that person is dead. And then I went, and then I just put that person, I just think that maybe that person is sleeping or something. I've never encountered, okay, I have seen somebody who is dead, but I've never encountered or touched somebody who is dead. So I took a wheelchair, then they the person, clinical officer came, then the person pronounced that person dead. I'm like, oh my God. So that is when reality just clicked in. And I'm like, oh my God, what the hell? Okay, I'm sorry for saying that, but that was how I reacted, like seriously. That is how I reacted. And then I just looked, and then I felt like I want to go home. And then I just stayed there because I could not, because I'm working. And not even talk to anybody because everybody was just okay. It's like any other normal day, but it was not normal for me. Okay, so that was not it. I didn't talk to anybody, so it was becoming overwhelming because now it was like every day, because even children were coming in. They were coming in for their clinical checkups and stuff. And then one day this lady came, like around 10, 11. Then she had said that she had gone from a very long way. She has been going from hospital to hospital. I think those hospitals were refusing her because they knew that child was dead. Now when that child came to our hospital, because it's a county hospital, so pronounced dead, brought in dead. And then I was asked to take that child to another room. So I already knew that she was dead, and I was so scared. But because I was asked, and I thought that that was part of my duty, then I just took her, and then I was really courageous, and then I took her there, and I was so remorseful to the family because it was a really young family. They were so scared. It was only a 2.5 years old child. So that day I felt like quitting. So it has been in my mind, how can I deal with this? Because it has been on my mind ever since. Now it's 1 year. And not even get that situation out of my mind. How do we deal with this kind of stuff? Because it's not literally taking over my life, but I've never seen such a thing. It has been very traumatic for me. It was something I've never done.
Okay.
Yeah, I've seen a dead person in a coffee, but not that. That was a child. And it is that and more in a hospital. How do you deal when you're in a hospital and you have to see these things and you're not even trained for them? Because people go to schools, 6 years medical school. Okay, people actually go to deal with dead people for I don't know how long. But how do you deal here, just a person there, you're seeing this? How do you deal with it? That is my question.
Okay. Thank you. Thank you very, very much, Sheba, for being so courageous to share to us your experience and being honest on what you are going through. Thank you so much. So first of all, I just want to tell you that whatever that you're feeling is absolutely normal. It is a normal body reaction towards a particular trauma, okay? And just like I mentioned before, trauma is a near-death situation. So death on its own, even by the mention of that term, death, yeah?
Yes.
It's already trauma, okay? So, and the other thing is that, first of all, you've said that you are not trained on this specific field. So you find maybe preparedness also, maybe you are not prepared for it. Those who are trained maybe have been exposed to several. And before, I've heard their stories that before even they get used to it on their practicum, on their trainings, it's a bit difficult. But now with time, with several exposure, and that's what we do even in therapy, we call it prolonged exposure therapy. Someone is able to overcome the trauma. Okay.
Yeah.
So So what we normally do and what we recommend is that every facility normally recommend for a debrief. Okay, whenever anything happens, even to all of us, you can pass also this message to the rest of your friends and family members or wherever that you are working in. Whenever any trauma happens, any trauma, be it of death, accident, anything that totally is that totally brings you an overwhelming feeling, the first step to do is what we call a debrief. That's what we call psychological first aid. Talk to someone. Talk to someone. Tell them exactly, what did you see? We call them the 5 senses. What did you see? What did you feel? What did you touch? Okay, what did you taste? What did you hear? Okay, so that one helps a lot because you are going to express your emotions there and then. So you find you are not at a risk of developing what you call post-traumatic stress disorder. So post-traumatic is post, post, the trauma has already happened. Traumatic, that trauma. Stress now becomes now disorder. Okay, but if somebody has gone through debrief or psychological first aid, just sharing, those are technical terms, just saying in simple words, if something happens, talk to someone immediately, express what you're going through. You can go to a counselor, you can go to any psychologist, or you talk to your friend, share, talk to someone immediately about what you are feeling. So that is going to bring some relief and some aspect of safety. And then now from there, now you can proceed maybe with other counseling sessions. So for now, for you, I recommend that you can attend counseling sessions, because what you do, because that's PTSD now, you find we do what we call prolonged exposure therapy now, so that it can help. Okay, so I recommend that you can attend in any counseling sessions. I'm sure Zed is also there. I'm also here, and anywhere that you can find a psychologist or a counselor, I recommend that you attend the session so that they can effectively help you. Is that fine with you?
That is okay, and thank you for that, because you already explained it well, because I've been doing some sharing with people. That is what I've been doing since I've been trained in a little bit of psychology, and I know like I should be talking to people, but there's I think there's something called being afraid, and actually, you cannot even be afraid at the moment, but I think it's psychological. That is what I'm talking about. That's why I actually came here, so that I can understand why is it psychological, because I know I am not afraid, but why am I feeling like I am afraid? What is not happening? I really wanted to understand, but right now I understand that you should share more. And I've shared it with now all of you, and I am feeling like it has been an eye opener, and the way that you've just explained it to me, I am feeling more confident that it's going to be okay.
Thank you so much. So it's going to be okay. However, just like I've recommended, what happens when you go to a psychologist? Okay, a psychologist is trained on this, how we do the psychotherapy. So you may find like you are not afraid, but you're wondering, why do you feel fear? Okay.
Yes.
So you find that probably there might have been a particular trauma that happened in your childhood. Okay. So you got fixated somewhere. But now, if you have thrown it back to your unconscious and you force yourself to forget about it. So that is why sometimes you just feel you're just scared. You don't even know why you're scared. Okay. So when you go to a psychologist, the psychologist is going to do something that you call psychoanalysis. They are going to take you through the journey of your life, and you are going to understand, why do you feel the way you feel. Okay. Because what happens, our human beings are like a 3 triangle. triangle, whereby we say that your thoughts are going to affect your behavior, and your behaviors are going to also affect your emotions. So there must have been something. So that it's a triangle. The way what you think is going to affect your emotions, and the emotions are going to affect your behavior. So there must be a cause. So I suggest if sharing is okay, it's a coping mechanism, okay, but it's very, very important to attend a professional counseling, seeing a psychologist, not a HTS counselor. HTS counselor is not a psychologist. Seeing a psychologist, right? They are going to help you a lot. Any facility, maybe public facility, or any other psychologist, Zed is here, or any other person that you know has done psychology. It's very key for you to visit them, so they can take you through the journey. Maybe something might have happened somewhere. That is why maybe, so what you saw is now in Ayamusha, it's trigger. The fear was there, but now you got the trigger now. Right?
Can I ask a
So
is it like there's something that I blocked out now? Because I don't think I have fear of death or fear of the dead, but I have a fear of something. Is that right, what you're saying?
Yes. There must be particular fear. There's something maybe happened, along the journey of life. That's why sometimes when you go to a psychologist, they'll just, they'll find a way of helping you get to understand what exactly is happening to your life. Okay. Also, sharing is a solution, helps a lot. Because that's like an example of prolonged exposure therapy. You get exposed, you speak about it, you feel the emotion, it helps you a lot. And also pale kazini pia, getting some debrief, if you have debrief, because I'm sure for now we've been told about the mental health at workplace. I'm sure right now they are going to initiate the debrief among healthcare workers and any other facility that deals with work, with staffs. So it's very, very key. Anyone maybe who is here and in any other organization that you're in, kindly try to bring in the idea of debrief. It helps a lot on your healthcare workers to help them, express whatever that they are going through, maybe at the journey of work, because vicarious trauma happens during our work. It's trauma that occurs as a result of work. So thank you so much, Sheba. So I think we can proceed from there as we are winding up.
Thank you. Thank you.
You are much welcome anytime. Okay. So maybe, okay, Zed can help us from there. Let me hand it over to him. Yes, Zed. I'm also seeing Nani's wanted to share something here. So,
thank you very much. Thank you very much. But before I proceed, I can see we have Nanis Kanana. Nanis Kanana would like to share her experience. Kindly, Nanis Kanana, proceed.
Okay, thank you. So I think probably, I'm not sure of the schedule, but I'm going to be brief. Maybe I'm only going to give one episode that I think for me gave me anxiety disorder. So am I audible?
Yes, you are, Nanis.
Okay. So at the initial stages of my career as a HOSH professional several years ago, so that time I'd left the university and I was relatively young. So I know as a HOSH professional, you're told like you in this workplace to prevent accidents and mitigation measures and stuff like that. So, but I'd never witnessed a major incident. So one time in a manufacturing company, one of the employees, there was an incident in the workplace, and one of the employees, very young, the the guy had just turned 18 or 19 at most, if I remember well. He got an arm amputation. So it was, I've already mentioned it was in a manufacturing company. So the accident took place in the factory, and one part of his hand was chopped off by a machine. So for me, that was the first major incident that I got to handle, and I've mentioned I was very young. So of course there was first aid. He was taken to the hospital, and when we went to the hospital, so there was the nurse, the site nurse, and no, when you got to the hospital, of course, by that time the family had been briefed, and they came to the hospital. So for me, it was a very overwhelming experience. That's still stuck with me until today, because the guy was just 18. So I'm thinking, as organization, really we've permanently like affected the life of a very young person. He was really, really very young, and the guy looked very innocent to me. And so so in my head, I was thinking, like, if this guy is just 18, he came to work in that factory, or 19, came to work in that factory because of the circumstances. Maybe that is why he couldn't go through a university program and something like that. But instead of as the organization helping him improve his life, now he has now this disability, something that he would live with for a lifetime. And when I was at the hospital, the relatives were there. They were really overwhelmed. They were crying. And I remember I've mentioned I was very young. So at some point, I even cried more than the relatives of that particular employee. So I think that was really the first major experience of a major incident at workplace. I don't think I was really prepared for it psychologically, in terms maybe what I went through the curriculum then when I was leaving campus, and the actual things that I would face when I went to the workplace. So I think it's something that affected me for quite some time, especially at my initial stages of my career. So, and I think these are some of the things maybe all professionals don't talk about, especially those that are especially the young professional and the mid-senior level. I remember at night, after the next few weeks, I remember sleeping at night, and my sleeping patterns are affected. Sometimes I would dream of other accidents that have taken place at work, and I'm at my house. So I think that destabilized me for some time, and it gave me some serious anxiety issues.
Okay.
Thank you.
Yeah. Thank you so much. Thank you so much, Nanis, for sharing. So indeed, life, things happen in a way that we do not expect, and anything that comes in a way that we were not anticipating for it may lead to certain fears. Okay, so what you felt was absolutely normal. It was our body's reaction towards the situation. Okay, you find yourself breaking down and develop a lot of empathy and sympathy, and then probably later on, maybe if you didn't get someone to share and talk to, it express emotions, what you saw, what you felt, what you touched, what you tasted, what you had. All of it just becomes enclosed into your own brain. It doesn't get a place to be ventilated out. So you find with time, now it becomes constant and worrying thoughts until it leads to anxiety. Yeah. So you find with that, as time goes by, like develop certain disorders. Now you're unable to sleep, you find restlessness, fear of that particular place, and that constant fear. So what you're feeling, what you felt was absolutely normal. Maybe what we can do, probably if it's still bothering you in some way, maybe it's still your journey of your work. It's very important to to also, I recommend that you can also see a psychologist, so that at least they can help you get to understand whatever that you're going through, and maybe also help you in also realizing maybe something else that you fear in your life, that now through a particular trauma you find like now it's like opening a wound. So I recommend that you can also see a psychologist. It's very important if you feel like there's need. Maybe sometimes you go to see a psychologist, not necessarily that you have to have a mental condition. Sometimes you find there are several thoughts, disturbing thoughts that we do have, that sometimes really interfere with the day-to-day activities when our relaxation becomes a problem. So we go to see them so that we get to understand what exactly is happening to our lives. So I want to say thank you so much, Nanis, for sharing. Thank you so much. And I am so grateful. I just hope that you've gotten, maybe you've benefited in one or the other through the program. Thank you so much. Then Sheba is saying if she can comment on Nanis' situation. Okay. Yes, Sheba. You wanted to comment on Nani's situation? Yes, the floor is yours, Sheba. Yes, Sheba. Sheba, you can unmute. The floor is yours.
Hello.
Yes, karibu.
Thank you actually for giving me that opportunity again. So I wanted to say that again, nannies should not be like, yeah, I know it can, you see the way that I was like, I actually went into the emotions of the family, you understand? But there are a lot of things that we go through in our day-to-day life when we go into our professional life, and it's really hard, and it's going to be hard, and it's not even going to be smooth any day, but it's our profession. And the way that she's saying, okay, sorry, I'm going to say that, yeah, we are in the same profession, and I know she's going through a lot, and I know that it's going even to be even harder, but that's the way of life. So whatever that we have to do, we have to just be strong, because I'm telling you, I actually had the courage to even carry somebody who is dead, and I actually had to carry somebody. I even have a lot of stories that I can tell you about how I even managed a lot of injuries at work, and it's never going to end. But you can't cry. You just have to be there for those people who want to be consoled, and be there for them, because life today, even us, because we are feeling that we are okay, we don't know what is waiting for us outside that gate, or outside that office, or outside even that coffee that you're taking. You don't even know. Even the thing that you're eating, you don't even know, because you can be shocked, and tomorrow we're at your place, we are going to your burial, and we never know. So we take life as it is. So yeah, that day that guy alivunjika mkono ama alikatwa mkono, but what do we do? At least ni mkono. Sasa what if angekufa? What could you have done? Yeah, it is bad because somebody has actually lost a hand ama a finger ama something, but you've saved that person, na bado anaweza kuishi maisha in whatever, I don't know what, but this is a very, very technological world. We know how to even go. People are building skyscrapers when actually hapa hivi Nairobi ndo tunaanza kuona ati vitu ndo ziko kubwa. People are actually flying. Sisi ndo tuko hapa hivi. You know what? Things are going, lakini just think beyond. That's all I'm saying. Think beyond. Like, if we can save one life, hata kama mkono imetoka, but we can save. We have seen people, they are actually having no hands, after having no even the lower body part, but they are doing okay. Why can we not do better with all our hands, limbs, and everything? Why can we not do better? But what I'm saying is that I'm not saying that that was supposed to be done to him. We are talking about a workplace. Workplace yenyewe inafaa kukuwa safe for everybody, and everybody has to actually follow the rules. Kama haiwezekani, wachana nayo. Kama inawezekana, okay, let's go on with it. Alafu ikifanyikana kitu ndo tujue enyewe, by the way, it was not supposed to. That is the only way. Yeah, let us not go crying on nini huko kwa nini, because we are health and safety officers, ati tuna cry huko hivyo kwa zitu aje kwa mahospitali ati kwa sababu maybe people think that we did not do our work. We did our work, but accidents happen. That's all I'm saying. But people should take care. Okay, that's all. Thank you.
Thank you so much, Sheba. Thank you for your contributions. Yeah, it's okay. So everyone's experience is different, and what you feel, whatever that you feel, is absolutely normal, actually, to all of us. Okay, maybe your experience to a particular thing might be different to the other person's experience on the same. So I'd actually want to recommend, maybe on the other sessions, I suggest that it's really important, if it's okay, maybe with the host and the rest of us, we can organize on a session on work stress management. Because one thing, you are here for a career. This is the career that you depend on until you retire. So we need to learn how do we cope with it. Because sometimes if we do not learn the coping mechanism, now you find that at the end of it all, we get drained, we get other medical conditions, blood pressure, and other mental conditions as well, So it's very important maybe for us to also learn on how do we cope with work stress management, because we are not the only ones going through it, others are also going through it. But now, how do we manage? How do we survive so that we rescue our health, we rescue our life? So that we get to know, maybe along the way, we'll just get to understand when we shall handle work stress management, that work is work. However, we are still human. We are not robots. We have feelings, we have emotions, which is perfectly okay for you to relay or express emotions. It's okay to cry. It's okay to cry. In fact, I encourage people to cry because it's a way that you're relieving the emotion instead of kirudisha. It's okay to cry. It is fine to cry. It's okay to relieve the emotions, however that you feel it. And then later on, maybe attend a debrief so that it can also help you go through the emotions. So thank you so much, Sheba, for your contributions. And thank you so much, Nanis. So maybe finally now, as we wind up, so I'm told that Linda says that Zedekia has webinars on workplace depression, which is okay. Thank you so much. I didn't know that. No, I'm aware. It's fine. So it's okay. Follow that, and it's really going to guide us and help us to know how do we cope and how do we manage these stresses that come in with work, that we do not end up with vicarious traumas. So I'm seeing that also Nanis says that OSH professionals, new mental health talks There were many hats, counselors, HR, implementers, it is especially young professionals, and never fully prepared psychologically for. Okay. Lucy, those experiences are great opportunities to learn from others. Thank you so much, Lucy. Thank you so much, Ananis, as well. So for the young professionals, that is why we go through attachments, and we also get to, it's very important for the young professionals to get to hear from others who have been in the field. You don't just go and just jump in. It's good to talk to others who are in the same field and ask them what are the experiences, so that you can also learn from them while you are in your attachments or internships. That one helps a lot. So, so thank you, Lucy. Lucy as well is saying those experiences are great opportunities. Thank you. Lucy Candy says, thank you so much for sharing. So all of you, thank you so much. I'm just seeing that here someone, Linda, there's something that Linda was, I'd like to give Linda a brief opportunity. How is it? Linda could share how did she overcome it from Patricia. So Linda, I'm just giving you like 3 minutes. Kindly, maybe you can just share with us as we wind up.
Okay. Thank you, Madam Chebet, for the opportunity. Once more. So much has been said. We've actually wrapped it all from what you have told us. Just to start with, life is tragic in itself. So this, hello?
Yes.
Yeah, life is tragic, and negative life events are not biased on anyone. I mean, I've been in my profession for the longest, and I have experienced a lot of deaths, but you can see we are still handling them from a human point of view. So negative life events will always be there, and we will always have hard times to manage them. But the key is to always have the coping mechanisms at hand with them. And I think you have shared it all. So for me, just to be very brief, I was able to, being at my workplace, because I'm with the government, the debriefing was not really there. But currently, Zedekiah has made it very clear, or rather the Ministry of Health has brought in the wellness program for the medics, which is very, very good. And so for me then, when it happened, because it's quite a long time, and it was my first experience with a maternity mother, and I had experienced other deaths, but this was with a maternity mother. And so I was able to get a lot of support. I did a lot of support seeking, but from before then, I focused on the problem, on exactly what, in as much as death is inevitable, what we could have done differently through the audits. And then from then, I did my own support seeking. I took my own support seeking measures, whereby I was able to share it with 1 or 2, 3 colleagues who had also gone through a similar experience, and I learned from them. And I also sought help from counselors, friends who took me through a whole process of discussing the grief, and they were able to, exactly what you said, they were able to point out on areas that I was also grieving on in my previous, or rather in my past life. And then from there, I continued with a lot of affirmations, because, hey, this is my career, and it is an area that no matter how much I would run away from, I would still go back to it. So I continued with my affirmations to give myself the confidence and the courage, and my spiritual life as well. And yes, so that's how I was able to overcome it. Currently, just to encourage the rest, I am very comfortable. I do the deliveries very comfortably. Yeah. The anxiety once in a while might pop in, because it's a nerve-wracking. It's part of our profession, but you're able to manage it, because now you have the coping skills at hand. Thank you so much, Chebet. Thank you.
Yes, thank you so much for sharing. I'm grateful that you were able to overcome the the trauma and you have learned how to cope with it. Thank you so much. Keep maintain those coping mechanisms. Keep moving. Learn to share. When you share, sometimes you can feel, hey, someone else has gone through this and this. It's very good to share. Continue working along with us as well. You find yourself, life just ups and downs will always be there. It's part of life. Yeah, it's just how we cope with it. So thank you so much, Linda, for your contribution. Okay, so Patricia is saying they can raise it with their employers. They need time to clinical supervision for them to grow that and overcome compassion fatigue. Need to go for therapy in order to get it out of their shoulders. Not yet dealt with grief. Dr. Patricia, counselor, psychologist. Sawa. Thank you so much, Patricia, and thank you so much, everyone. It's my hope that we have all gained something. As I welcome Zedekia, maybe we can just put our thoughts on the sessions. Have you learned something? You can just say something on the wall chat as I welcome Zedekia. Maybe if there's something you'd like us to change, if there's something you'd like us to do better, if there's something that I have done well as well, I recommend it's very good for if we can bring it up in the chat so that you can also get to know where to pull up our socks, you get to know how can we continue doing the program better. Thank you so much, and I welcome Zedekia. Zedekia, the platform is yours.
Apologies, our guest. Thank you very much. I believe this was a very good, wonderful presentation, very educative, interactive. People share their experiences, which is very good. I like it. And it is during this time that we are moving towards the right direction, especially when we have the document or the booklet or the guidelines which have just been released, which talks about the national guidelines on workplace mental wellness. Thank you very much, all those who have attended. I really appreciate. Remember, it is through you that you are able to run the webinars. The webinars need to be supported. The people who support me during the paid version of the webinars, Asanteni sana nashukuru. I know the charges are very minimal, 200 shillings. The 200 is the one which supports this recording. The 200 is the one which also supports us during our live streaming on YouTube. Right now, we are live streaming real time so that we can reach audience out there. So as our tradition, we usually have 1 week for paid webinar, the other week for free version. Then the next week or the following week is also a paid webinar. Remember, the payment is supporting this good cause. It's supporting the recording. It is supporting the presentation. It is supporting the live streaming. And we'll be able also to reach other people out there. Asante sana, Chebet, Suzanne. Asante sana. Maybe you can show our appreciation by going on the screen. We have a reaction. We have a reaction icon. For me, I will clap that reaction. Others, you can pick any reaction. Thank you very much. We have Patricia Mutula, asante sana for the reaction. Linda, asante sana. Thank you very much. Without further ado, asanteni sana, I think we'll wind up. For others, we'll meet in other platforms. For those who are in safety, I'm also in safety, we'll meet in other platforms. Kindly be my ambassador. Let's push for this agenda. Let's push for this agenda in order for us to have good workplaces with people who are mentally stable. let's not talk about the production only. Let's talk about the well-being of that worker who is working towards achieving the objective of that organization or company. Asanteni sana, shukrani sana. Thank you for your support. I really appreciate. Susan Chebet, asante sana for your time. I really appreciate. And for those people in the group, we have a presentation. We'll share the presentation. We just wait for a few minutes. The recording will be uploaded in the cloud, and then we'll do the editing, and then we'll share the recording. Thank you very much, and may God bless you, and have a nice weekend. Maybe one of you, if you have something to say, this is the time to say. If you have anything to talk to us about the presentation for today, asanteni sana na karibuni sana. Thank you. Lucy Kendi, I can see your chat. You're saying the session was so informative. Karibu sana, Lucy. Karibu sana. So for those who are in the group, you are welcome to suggest any other session which you feel you need to discuss during this month of suicide prevention. Shiba Isa, when is it going to be uploaded? Right now we are live. Immediately after finishing this session, just give some few minutes and then it will be uploaded, then sent to my email, and then I'll be able to access, and then I'll edit the video, then I'll send it back either to the group, or you can send us your email address so that we can send you the video. You can kindly inbox or send the email address. Let me type the number which you can send your email, and then we send you the recording. So that is my number. You can inbox your email for the recording. You can inbox your email for the presentation, because I'll be able to share the presentation so that at least we have something at hand whereby we can refer. Thank you very much. I don't want to take much of your time. I appreciate, and we are free to start the weekend. Asante sana.